Hi, my name is Tristan Swingle, and I am the pelvic floor physical therapist here at Vitality Pelvic Health. And I wanted to get on here to fill everyone in on what exactly pelvic floor physical therapy is, how to know if you might benefit from pelvic floor physical therapy, and also what to expect in that first initial visit. So pelvic floor physical therapy is a niche of physical therapy, and it focuses on the pelvis specifically, but it is not limited to only the pelvis. It includes the musculature of the pelvis, the organs inside your pelvis, as well as your abdomen. It includes your back, your hips, your sacrum, your tailbone, and anything pretty much from your diaphragm to past your hips. And so that is our niche of physical therapy. That's really the area of the body that we focus a lot on. And so the different things that people will come to pelvic floor physical therapy to start to address can be any type of pelvic floor weakness, and that can include bladder leakage or bowel leakage. It can also include increased frequency of urgency of the bowel or bladder. It can include any type of dysfunction that somebody might be experiencing during pregnancy, be that pain or weakness, instability. And then it can also include postpartum dysfunction, which kind of includes the same things of pain and weakness, and even just postpartum recovery to be strong in that fourth trimester. The other things that I typically treat include any type of pelvic organ prolapse, back pain, hip pain, pelvic pain, and that could be from pubic symphysis dysfunction or other underlying things, as well as core weakness and diastasis rectus abdominis. So that is a lot of things that I treat. That's not every single thing that I treat, but it pretty much hits on those big ones. And so if you are someone who is experiencing anything from your diaphragm to just past your knees, or any of those things that I just listed, then you could very well benefit from seeing a pelvic floor physical therapist. I have been treating pelvic floor dysfunction for the last 4 years, and am very passionate about getting to treat women and men in this patient population. And so if you're coming to physical therapy, you've watched this video and you're like, okay, I know that I would benefit because I'm dealing with this specific dysfunction. But now you're wondering, what exactly does that first visit look like? So whenever we do an initial evaluation, we are going to gather a thorough subjective history from you. So I need to know different information on when symptoms started, how long they've been going on. We want to know the severity and the impact that they're having on your daily life. So we're going to get pretty in depth on all the different things that you're experiencing so that we can just really be able to move forward in that initial evaluation. Based on what you're telling me you're dealing with, kind of like leads how I move forward with the rest of the assessment and the different objective measures that I'm going to take in that first visit. And so oftentimes, if anyone is experiencing pelvic floor dysfunction such as pain or weakness or prolapse, or they're pretty soon postpartum, then what I'm often doing in that first visit is an intravaginal muscle exam. And so if I am doing an intravaginal muscle exam, I have been certified in that through the Herman and Wallace Pelvic Rehabilitation Institute. And I am using a gloved index finger to perform that assessment of the 3 layers of your pelvic floor. And so we need to know, how is your strength? What is the range of motion and the mobility in your pelvic floor? This is another muscle group in our body. And so if we are experiencing any tightness or weakness or pain in that area, we really need to address it. And that is the most thorough way that we can really assess the pelvic floor. So I always start with that intravaginal muscle exam as long as everyone is comfortable with it. And then from there, we also work towards the outside. We need to know what's going on in your low back, what's happening in your hips, what's going on with your pelvis, how's the strength in your core and your lower body. All of these things are relevant whenever it comes to pelvic health, and we really don't want to leave any of that out. So those are all things that you can expect to have done in your first visit, just to give you a heads up before you walk in and you just don't really know what you're getting yourself into. So that is kind of a quick rundown on what pelvic floor physical therapy is, who might benefit from it, and then also what to expect from that first visit. If you have any questions about any of that, if there's maybe a diagnosis that I didn't list that you're curious if I treat, or you have further questions about the assessment or anything like that, please do not hesitate to reach out to us. You can send me a message. You can also call our office number, whatever is most convenient for you, and I am more than happy to answer any or all of those questions for you. Thanks.